So in this video we are going to talk about the vascular test for the cervical spine or the clearing signs for the cervical spine. This video is a continuation of the special test for the cervical spine, but now we are moving towards the vascular test. So when you talk about the vascular test for the cervical spine, you mainly consider two major arteries, vertebral artery and internal carotid artery. Now, why? There are so many controversies, but let me talk a little bit about when you are going to perform the vascular test for the cervical spine, mainly in three conditions. Number one, when you are giving end range mobilization or manipulation treatment. Number two, so when you are considering the rotatory component of the cervical spine greater than equal to 45 degrees. And number three, when a therapist considered giving the treatment to the upper cervical spine. Upper cervical spine is from C0 to C3. Now, vertebral artery is the continuation of the subclavian artery. It enters the transverse process of the sixth cervical spine. It exits the transverse process at the level of axis. It rounds around the atlas, and before entering the foramen magnum, it merges with the vertebral artery on the other side to form the basilar artery. This position, when it exits the transverse foramen and before entering the foramen magnum, this spot is the most vulnerable spot for injury to the vertebral artery. Now, vertebral artery injury symptoms will be considered by 5 Ds and 3 Ns. So, what's the 5 Ds? So, dizziness, drop attack, dysarthria, dysphagia, and diplopia mainly. Now, 3 Ns. So, nystagmus, nausea, and numbness. So, which position you check the vertebral artery test? Mainly in the position in which a therapist considers giving the treatment. But ideally try to check the vertebral artery signs and symptoms in sitting position. Because why? Because the gravity pulls the blood down and the range of motion in the cervical spine again hampers the blood flow. Hold that position for at least 10 to 30 seconds. There are so many special tests for the vertebral artery insufficiency, namely Barre'sTest, Hautant'sTest, static vertebral artery test, vertebral artery quadrant test, and Nafziger test. You don't have to perform all of the tests. Just one test is enough. But if the therapist considers performing more than one test, hold or give a lapse of at least 10 seconds between each test to avoid any latent signs and symptoms from the previous test you already performed. Now, as I said, there are so many controversies like VBI tests are not effective or VBI tests are not convincing. So in the year 2009, a meta-analysis published by Dr. Janet Mitchell, who said that VBI tests are not convincing, that you stretch the vertebral artery and the blood supply is more hampered in healthy individuals compared to the patients. Before we talk about the special test for the vertebral artery, let me talk a little bit about it goes with the opposite side. So when you check the cervical spine range of motion on the right side, you are stretching the vertebral artery on the left side, and when you move the cervical spine on the left side, you check the vertebral artery on the right side. So as I said, there are controversies. So Dr. Janet Mitchell in the year 2009 published a meta-analysis like, oh no, VBIs are not making any sense. So in a void to eliminate all these controversies, try considering the Australian physiotherapy protocol for pre-manipulative cervical spine for any mobilization and manipulation. I tried searching online. I requested that if I can get, I'll explain it in my coming video. So we'll start with the Barre'sTest first. So Barre'sTest, how you perform. The patient is in a standing position, shoulder flexed to 90 degrees, elbows extended, forearm supination, and ask the patient to close the eyes. If the patient loses the balance, arm drop down or forearm pronation, that means that's a decreased blood flow to the brainstem. Second test is Hautant'sTest. Now, Barre'sTest is the first part of the Hautant'sTest. Now, Hautant'sTest is going to differentiate from a dizziness and vertigo caused from the vascular origin. So, in that first part, ask the patient, Hautant'sTest, patient is in a sitting position. Ask the patient to close the eyes, flex the shoulder to 90 degrees, elbows extended and forearms supinated. Any movement or wavering movement in the arm indicates that this shaking of the movement of the arm, it's non-vascular in origin. Now, what's the second part? So in that, ask the patient to same sitting, eyes closed, shoulder flexed to 90 degree, elbow extended and forearm supinated. Ask the patient to either rotate the neck or second, extend and rotate the neck. Hold that position for 10 to 30 seconds. If there is any shaking movement in the arm, that indicates a decreased blood supply to the brain. Lastly, the Barre'sTest. So Barre'sTest is patient is in a standing. Ask the patient to close the eyes, extend the neck and rotate the neck to one side. We are going to check, of course, on the other side too, extension and rotation of the cervical spine with eyes closed, shoulder flexed to 90 degrees, elbows extended and forearms supinated. Ask the patient to march at the same position. 3 tests. So either patient loses the balance, either patient will have the pronation of the arms, or patient drops the arm. That indicates that the patient have vascular origin in the brainstem region. Thank you.